historically, the way ICT has been introduced into the NHS, it's been considered a necessary evil, something people have to do.
Healthcare has moved on. Patients' demands are changing or needs are changing. They do ask the questions, why am I taking a day off work to come and see you when I could have done this more simply?
We need to improve the way that we work with our service users and patients.
If you can't provide that and some of the modern ways that people live, you're not providing a very good experience.
The Trust had previously outsourced its technology to a managed service provider. So all elements of the infrastructure, the service desk, the networking, the hosting, and it's probably fair to say that we weren't getting the benefits out of that relationship in the way that we expected to. So we did quite a lot of research around what would the next phase in ICT look like. We knew we wanted a cloud solution. We knew there were options available in terms of private cloud and public cloud. So a number of the public cloud providers directed us towards Rackspace. So naturally, we started talking to them. You know, we're a massive organization. We've been around for a long time. We've got terabytes and terabytes of data, and we're required to retain a lot of it for legal reasons. So the first thing, obviously, we want is security. Another key one would be scalability. We've had to scale up our remote working dramatically. So we went from 200 concurrent home workers to 2,000 concurrent home workers in a matter of 48 hours. And Rackspace, along with our other partners, were able to provide that infrastructure uplift to support a massive change in the way that we work as an organization.
One of our clinics where they were doing video consultations, the feedback was they absolutely loved it.
We need to store that in some cases. Storing video is not trivial. We need a cloud provider that can scale up and provide that storage to us if we need it as we move into a more digital way of working with our patients. Following the pandemic, whatever that means, you know, when things get back to whatever the new normal looks like, there's going to be massive change across the NHS. We've done about 3 years worth of transformation in 3 months. It's been phenomenal, the amount of change that's gone on. So we don't know what the future looks like. We don't know how we're going to be providing services this time next year. We don't know how this pandemic has changed the architecture of the NHS. The technology needs to support wherever we're going with this. So I think the confidence that I've got from Rackspace and their very broad offering is that I know that they'll be able to support me almost irrespective of where we end up.